Today we are here to commission another ETU. Actually, this is our 7th ETU that we are commissioning. We have 3 Ebola treatment units in Mubende. We have a treatment unit in Kasanda. We have in Entebbe, and here in Mulago we have 2, one permanent one, and this is a semi-permanent one, bringing the total bed capacity to about 356 beds now for treatment of Ebola patients. And I want in a special way to thank MSF that has constructed this unit, but also to appreciate all partners, because as you have moved around, you have been seeing that it is not a single partner work. All partners have come together, some to bring the tents, others to bring the money, others to bring the pipes, others to bring the consumables, others to bring the health workers. So it is combined efforts to make an ETU come to a functional state. Many of you may be wondering why we are commissioning this ETU at this time when we are no longer reporting cases. But you may be aware that today is our 11th day of no case, because we are on the first 21 days countdown. We are just 11 days because on the 29th we had a macerated stillbirth that tested positive in Kasanda, but also the last patient was discharged from the Mubende Ebola Treatment Unit on the 30th. So we began our countdown on the 30th, because the countdown depends on either the last discharged case or the last burial. So until the 10th of January, we will be on a countdown. If there are no more cases, then we can declare with guidance from WHO that Uganda is Ebola free on the 11th of January. If any case pops up, then we go back to the drawing board and continue with the management. So far, we are not seeing any new cases in the greater Kampala area, neither in Masaka or Jinja, and many of these districts have already completed their 21 days countdown. So the district that is slow is Kasanda, and we still have suspects in Kasanda and Mubende that we are following up, but no suspects in Kampala or the greater Kampala metropolitan area. So to date, we have registered 142 confirmed cases. We have discharged 86 people, and we have lost 56. But with a mortality that is not so high, about 40%, thanks to the health workers who have done a lot to ensure that the population are protected. But in a special way, I really must thank the communities, both in Mubende and Kasanda. Outbreaks begin in the communities and in the communities. And we have seen the communities take up the mantle to end Ebola. And they did this door to door, educating one another and also reminding them about the importance of reporting early and reporting either yourself or your neighbor and going to the health facility so that you can be treated and you get better. Because if you go early, then the outcome is more favorable. This happened more in Mubende than Kasanda. That is why there was higher mortality in Kasanda. Kasanda still needs a lot of risk communication that will continue. Even after we have declared that there is no more Ebola, there is still a lot of work to be done in Kasanda because of their myths, misconceptions, and beliefs in witchcraft and many other things. So the work will continue. So after the 42 days countdown, if we reach there without any case, there will be another 90 days of intense surveillance before we can be absolutely sure that there are no other cases of Ebola. This facility will remain here because, as many of you have seen, it is not a temporary facility, it is actually semi-permanent. So it will remain here and we'll use it as a training unit. Right now, it is open for treatment. If we get any suspect cases or we get any confirmed cases, we will treat them from here. It has provisions for laboratories, so we'll be testing from here. It is constructed in such a way that it can be upgraded into an intensive care. You have seen the inlets for oxygen, for fluids, so we can manage the patients from here. And until after the 42 days, it remains a treatment unit. Thereafter, we'll convert it into a training unit. Our vision is that we train health workers in all the regions of Uganda in preparation to have a resilient system that can withstand any shock. So we'll be bringing health workers and taking them through the systems and getting them trained. But also with support from WHO, we hope to have this as a training unit for the East African region, and who knows, it can also act as a training unit for the African region, because there is no country in Africa that has facilities for managing Ebola like Uganda does. Uganda has both permanent facilities like the one in Entebbe and the one in Mulago here, and these semi-permanent ones. So there is no better country to offer training facilities like Uganda does. But also it is an advantage for us because just like DRC, we have had several Ebola outbreaks. This is our 7th outbreak. So it is only important that we continue to put systems in place for managing Ebola and becoming more and more resilient. So we appreciate the incinerators that came in today, more generators came in today, and more tents in the event that we have to put up more treatment units in other places. So once again, allow me to say a big appreciation